Hello and welcome to your home medical provider. In this video, we'll be discussing strep throat, a bacterial infection of the tonsils and throat. We will be going over different symptoms of strep throat by age groups, types of testing for strep throat, contagious period for strep throat, and treatment. Symptoms of strep throat differ for people of different age groups. People ages 12 years old to adult typically have a combination of rapid onset of severe sore throat, fever, swelling of the lymph nodes of the front of the neck or generalized swelling in this area, and yellow or white pus-like discharge on the tonsils or in the back of the throat. Typically, strep throat doesn't come with a cough. Children between the ages of 3 and 12 years old typically have a combination of sore throat with enlarged red tonsils, yellow or white pus-like discharge on the tonsils or the back of the throat, and enlarged tender lymph nodes in the front of the neck. They can also have an enlarged uvula, which is that little hangy ball in the back of the throat. Children under the age of 3 years old typically have nasal congestion or discharge, a low-grade fever, so below 101 degrees Fahrenheit, swelling and tenderness of the front of the neck. For children under the age of 3, a sore throat tends to be more mild if they have a sore throat at all. Infants 1 year old and under will typically have less specific symptoms of strep throat. Symptoms like low-grade fever, being more fussy than usual, and decreased appetite. Babies with strep throat are going to have exposure to older children, such as babies in daycare or children with older siblings. All people with symptoms of strep throat should be tested in clinic by a medical provider. Rapid strep tests are quicker to get results and cheaper than PCR tests, but have a higher false negative rate. Positive results of rapid strep tests tend to be accurate, but negative results of the rapid test should be confirmed with PCR testing that are more accurate. It is an option to go straight to the PCR test for strep, but this can take longer to get results back, typically within 24 to 48 hours, and is more expensive than the rapid test. All pediatric patients, adolescents, and younger need to be treated for strep throat with an antibiotic. Strep throat in these patients can lead to other complications such as streptococcal rheumatic fever, otherwise known as scarlet fever, and post-streptococcal glomerular nephritis. Streptococcal rheumatic fever is a condition in which the heart, blood vessels, and joints can become inflamed and painful. Post-streptococcal glomerular nephritis is a disease which involves the filtration portion of the kidney, which leads to decreasing kidney function. Adults with strep throat tend to not get these conditions, so treating with antibiotics is not as necessary, but it can cut down recovery time by 24 to 48 hours. People are no longer considered contagious 24 to 48 hours after the start of antibiotic treatment, as long as their symptoms are improving and they are fever-free. This would be the best time to switch out the toothbrush to avoid reinfection of strep throat after completion of the antibiotic course. Treatments for strep throat in addition to antibiotics include increasing hydration and rest, analgesic medications such as acetaminophen or ibuprofen. These help to make the sore throat less painful and treat the fever. Drinking warm fluids and using saltwater gargles are helpful for soothing a sore throat. Medications such as dexamethasone, which is a steroid drink, and lidocaine gargles, which is a topical anesthetic, can be helpful for treating the sore throat as well. Prescriptions are needed for these medications. I hope you or your loved one is feeling better soon. Should any symptoms get worse or any new symptoms arise, follow-up medical evaluation by a medical provider is recommended. Thank you for watching, and if you found this video helpful, please like and subscribe for more videos.